Okay, well, welcome everybody. We're going to get started on our 12th episode, I believe, of our ATS Critical Care Forum. Thank you for joining us today. One moment. Okay. So welcome to our, like I said, ATS COVID-19 Critical Care Training Forum. I just want to acknowledge our training forum leadership. We've put on several of these episodes so far. They've all gone very smoothly, thanks to all the people on this slide, but particular thanks to our ATS staff, Lauren, Liz, and Eileen for suggesting this idea, working out all the kinks with it, and really making this a success. So special thanks to you guys. I just want to highlight some of our past ATS COVID-19 training forums that we've had. We've had a session on oxygenation and vent management. We've done one on clinical presentations and challenges from hard-hit areas, sedation challenges, palliative care and end of life, care of patients from home to the ICU, post-COVID healing, theology in COVID-19, multi-organ failure in COVID-19, including organ failure of the heart, kidneys, and brain, medical education during this time, immune responses, and our most recent one, hypercoagulability in COVID-19. You can see all these sessions on our website where we have the archived videos here. Here's the QR code to scan, but you can also Google COVID-19 Critical Care Training Forum at ATS, and that will also take you to our website. Please give us feedback. This is the QR code to a survey. We'll be asking you multiple times during this talk for the chat, in the chat box, to give us feedback. It's really helps us figure out what it is that would be interesting to you all, what you would like to hear about, so that we can move forward with topics that would be of interest to you. So with that, I would like to introduce our speakers and our session for today. Healthcare provider wellness during COVID-19. Healthcare is not selfish. I think this is, out of all the topics we've given, I think this is probably one of the most important topics, if not the most important topic. It's so important to care for ourselves so that we can better care for our ICU and our pulmonary patients. So I would like to introduce our two speakers for today. So Dr. Rosemary Adamson is a pulmonary and critical care physician at Seattle. She's at the VA there and an associate professor at the University of Washington as well. Her professional passions are providing excellent healthcare, improving medical education, and attending to healthcare provider wellness. Her personal passions include raising her two children, outdoor exercise, and striving to be her best self. On a personal note, I have known Rosemary for many years now, can attest to all these things in her bio, and that she does a spectacular job being well and emulating that for the rest of us when we're having hard times. So thank you, Rosemary, from a personal take on that. Dr. Ni-Cheng Liang is a pulmonologist, mother of two, cancer survivor, and a mindfulness teacher. She is the ALA San Diego Lung Health Provider of the Year pulmonologist in 2019, a San Diego Top Doctor 2017, and a mindfulness teacher. She's the medical director of pulmonary services for the UC San Diego Center for Pulmonary and Sleep Medicine, and the immediate past executive director for the Center of Mindfulness there. She was recruited to her current position as the director of pulmonary integrative medicine at Coastal Pulmonary Associates, which is affiliated with Scripps Health, and maintains an assistant professor of medicine appointment at the University of California, San Diego School of Medicine, where she volunteers for their free clinic there. She's presented and led multiple workshops and retreats locally and nationally on mindfulness, physician well-being, integrative, and pulmonary medicine. She is also the founder of the Mindful Healthcare and Healings Collectives, providing free evidence-based online wellness sessions for healthcare professionals and the general public. In her free time, she enjoys spending time with her family, two daughters, and her husband. She's a paddling enthusiast, paddleboarding and participating as part of a Team Survivor Sea Dragon. which is a dragon boat team comprised of women cancer survivors. So welcome. Thank you both for doing this session for us, and we're so looking forward to hearing what you have to say on this very important topic. So Rosemary, you want to share your screen?
Sure. Let me do that. Let me find the right button, find the right screen. How are we doing? Have I shared the right thing? Great. That's a good start. Well, thank you so much for having us. And thank you to Ni-Cheng Liang for joining me. I am going to make my slides advance. There we go. And so I thought I'd start with, I wonder what that was. Excellent. That gave everybody time to read the quotes, which were just a little intro, just a little thought-provoking. This is our roadmap for today. So we're going to talk a little bit about why self-care is not selfish, which I might have made the title because I still need it as a mantra for myself, perhaps, maybe. We'll talk a little bit about what is self-care. Dr. Liang will lead us talking about mindfulness, and we'll wrap up with thinking about what are some practical steps for you. What are some things you might want to do after this session?
So I like to start discussions about wellness with this definition from the WHO, that wellness is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. And I think this is super important for us as healthcare providers, because I think we have a tendency to think of people who don't have disease as being well. And this definition tells us that the absence of disease is necessary but not sufficient, and that wellness is this state of complete physical, mental, and social well-being. And this is important not only for ourselves and how we feel and our families, but actually really important for our patients. So there have been multiple studies done, mostly looking at burnout and the effects of burnout. But these studies show us that when healthcare providers are not well, that the care they provide is of a lower quality, that the patients are less satisfied with it, and that there are increased patient safety events. So we become more dangerous when we are not well. And that as a result of burnout and lack of wellness, healthcare providers will reduce the hours they work and also retire early. And this has an impact on the healthcare system. In fact, this is sort of part of the business case for why it is important for institutions to attend to the wellness of healthcare providers. So not only is it important for our patients' care, but it's important for their bottom line. And this is known to many societies, and a statement was written by a collaboration of critical care societies, published in 2016, particularly looking at critical care, where rates of burnout among critical care providers are particularly high compared to other branches of medicine. And this diagram is showing us that the ICU environment has some particular characteristics that will interact with the personality traits and characteristics and organizational factors. And that in the ICU, in particular, providers can experience moral distress and compassion fatigue. And these can contribute to burnout syndrome and the outcomes I've already mentioned, but also PTSD, depression, anxiety, and other psychiatric conditions for the healthcare providers. I found this graphic recently, which I think is pretty helpful for thinking about this time, thinking about this COVID-19 pandemic. And it really rung true for me. So on the left side of the screen, pre-disaster, I can remember December and January when there were items in the news about this novel coronavirus in China. And that was the threat. And then the pandemic hit, and it became apparent that there was COVID spreading in our communities. And there was this sense of community cohesion. There was this sense of us all pulling together and working so very hard. And depending on where you are and the levels of COVID-19 in your state, your region, your hospital, your county, you'll be at a different point on this graph. But I think in many places we've dropped down this slope in the middle. And perhaps we're now on this upward trend on the other end, where this graph talks about disillusionment and then coming to terms and working through grief, and that we need to get through that before we'll be able to reconstruct a new beginning and work out how we live in our new normal life. And I think this phrase grief might be helpful for thinking about our reactions to the COVID-19 pandemic. There's an excellent piece in the Harvard Business Review, an interview of David Kessler, who has written books like The Stages of Grief, in which he used those stages of grief to describe people's experience of dealing with the COVID-19 pandemic. And these stages of grief ring true. I'm sure that all of us, we may not personally have experienced every single one of these, and you don't need to experience them in the order that they are displayed often, but I'm sure we know of people who've experienced all of them. And he talks about how hopefully we can come through these stages of grief, and hopefully we can find this sixth stage of grief, which is finding meaning. So this is a particularly difficult time for us, I think, in healthcare and indeed for everybody dealing with this COVID pandemic. And so it seems particularly important to think about what is wellness and what is self-care. So I'd like to take a little moment for a poll. I'd like you all to sort of breathe for a moment and think about how you are feeling. So think of your emotions like the weather. How do you feel? And a poll will be launched shortly that you can answer, and you can choose the weather that you're feeling. And if the poll doesn't speak to you, if those choices don't work for you, then enter into the chat box.
Like we have a mix of weather, Rosemary.
Well, we're not all in the same place, both literally and metaphorically. I'm pleased to see some people feeling sunny. It seems like the majority of people are feeling partially cloudy. And we've definitely got some rainy and some stormy, and fewer breezy. So that was just supposed to be a moment for you to think about how you're feeling. Thank you for joining in, for taking that moment. Sometimes it's easier for us. You know, we so often ask each other, well, how are you? It's sort of a polite thing to do. We don't always answer it completely truthfully. And sometimes we don't actually want people to answer it completely truthfully because that will slow us down. Sometimes it's easier to answer a question such as this, where you get the opportunity to truly say what you mean. I mean, if you're feeling stormy and rainy, you're maybe not having such a great day, but you don't necessarily want to say those words. So it's just a way of sharing how you're doing, perhaps in a way that feels more acceptable. So hopefully that was a convincing argument for why self-care is not selfish. But now let's talk a little bit about what is self-care. So there are a number of models that have been made for thinking about what are the factors that affect healthcare provider well-being and resilience. And this one is from the National Academy of Medicine, and you'll see that it has the factors colored either yellow or blue. And the majority of factors are these yellow factors. And those yellow factors are the societal, cultural, institutional, organizational factors that affect healthcare provider well-being. And the blue factors, which are a much smaller number, are the host factors, so those personality traits and personal skills. And I wanted to put this up here because it is often the case that when talking about self-care, it can feel a little bit like you're being told that you have to do a better job of taking care of yourself and you need to find all of these different things to do. And that's not what I want to convey. I put this up to show you that the majority, the yellow side of this, illustrates that the majority of factors affecting healthcare provider well-being are not host factors. They are societal, cultural, institutional, organizational factors. They can feel a lot harder to change. They can take longer to change, perhaps, than changing personal choices about how we spend our time. But I think that's really important when we think about how to take care of ourselves, that there's a lot about what we do on a daily basis, about our jobs, that affects how we feel. So the literature on resiliency and wellness reveals 3 keys to resiliency, and they are healthy social connections, positive emotions, and a sense of purpose. So these are 3 areas to really think about, and how can you cultivate these? And this is important when we think about those institutional and organizational factors. Actually, at the beginning of this session, when my audio was working fine, before we let everybody in from the waiting room, Dr. Liang was making the point that Dr. Cribbs, Dr. Liang, myself, and a couple others were chit-chatting before the start of the webinar. And that was a healthy social connection that we were making there. It's known that that's good for us. At work, I think we can feel very pressured to get through everything that needs to be done. And one of the things that is easiest to get rid of is chit-chat. Chit-chat might be a waste of time. So let's not chit-chat, let's not chit-chat in the hallway. And I think particularly with Zoom meetings, with everything being on Zoom online, there's probably less of the chit-chat. Once you've got a few people on a Zoom meeting, it's very hard. You keep sort of talking over each other. It's an important thing. So cherish it when you get the moment. I think, in fact, one of the things about the COVID pandemic that I'm really lucky, and healthcare providers in general are kind of lucky, is that we get to go to work. I'm sure many of you have partners or family or good friends who do not get to go to work and stay home every single day. And they probably get even less chit-chat. And it's an important thing. It really helps us feel good. So those are 3 keys to think about going forwards. And then I'm going to share this mnemonic, refresher. There are a number of different mnemonics of thinking about what are all of the different ways to self-care and take care of yourself. And I like this one because the word is positive, refresher. It works well. And because it's actually quite a long list, it's quite thorough. It probably captures the things I've seen in other lists. When we look at this list, sometimes some of the things on the list can feel frivolous. Fun, recreation and enjoyable activities. Turns out they're really important for our own well-being. And so if you might be the kind of person who needs to schedule things to feel like they're worthwhile, maybe you need to schedule fun. We'll talk more about mindfulness, which will really is a good approach to relaxation and stress management. There are many things on this list that we all know are good for us, you know, exercise. Some of them, again, can feel a little bit like, well, how do I make more time? How do I suddenly find time for that? I don't want you to leave this feeling like, well, now I know I need to start jogging again. You already know that getting exercise is good for you. There are some things that we can do that really don't add time, that we don't need to find or make extra time for. One of them that I wanted to just mention and highlight a little was this notion of positive emotions. Coming back to those 3 keys for resiliency, there are various ways to cultivate positive emotions that really don't take extra time. So on an individual level, you can find some time like your commute home, where you could reflect on your day to be thankful for some of the good things that happened that day. If you like journaling, that is a very evidence-based way to improve your wellness. And sending thank you notes is actually really beneficial for yourself, for the person sending the thank you note. I mean, we all like getting thank you notes, but it turns out that it's good for the sender as well as the receiver. Thinking a bit about our communities that we work in, cultivating gratitude among a community is also a really positive thing that can be done for everybody's well-being. So making sure to find the time to express gratitude during meetings or within the community of your family to talk about good aspects of the day at dinner or bedtime. And thank you notes work well, both in and outside of work. So those are some thoughts about what is self-care. And now I'm going to ask Dr. Liang to unmute herself. And she's going to lead us through thinking a bit about what is mindfulness.
Thanks so much, Rosemary. And thanks everyone for being here. I wanted to bring about the definition of mindfulness, and it's nothing more than really just paying attention to the present moment without any sort of judgment. And this quote was by Jon Kabat-Zinn, and he's the founder of the mindfulness-based stress reduction course that has been used all around the world and has been really the foundational intervention that has been used in a lot of the mindfulness literature that now tallies over 9,000 articles on PubMed. How does one practice mindfulness? So oftentimes there is an anchor of attention, like the breath. But nowadays with coronavirus, the breath might actually be quite triggering. And so we can pick other anchors, such as the sensations of our hands or the sensations of our feet, as alternative attention anchors. So we choose the attention anchor, we pay attention to that attention anchor. Our attention is inevitably going to wander because that's how our brains were wired. And we notice this wandering, and we bring our attention back to that attention anchor. And this is going to happen over and over again during any particular practice. And the key to doing this is that you notice the wandering, you bring your mind back to the attention anchor, all non-judgmentally. So basically, if this wandering happens 100, 1,000 times, you simply notice and bring your attention back to that anchor, your focus of attention. Mindfulness has been shown to evoke our brain's ability to change for the better, structurally change. So in terms of what mindfulness actually does for the brain, it decreases the gray matter in areas responsible for the fight or flight response, our sympathetic nervous system, and it upregulates and increases the gray matter responsible for compassion and empathy. At the time of publication, this slide was theoretical back in 2009, but after 10 years plus of data, this slide is actually pretty spot on in terms of the mechanisms of action of mindfulness. So we know that mechanisms of action include that mindfulness decreases stress cognitions and therefore decreases stressful physiology. And that in turn can protect telomere length. And so we know that telomere length has a lot to do with diseases as well as aging. And with mindfulness, you can also upregulate positive cognitive states as well as positive physiologic states, such as increasing vagal tone, upregulating the parasympathetic nervous system. But I will say also that the cortisol data hasn't exactly panned out in as clear of a way as one would have hoped. So we don't quite know for sure if it ultimately decreases because of mindfulness practice. Lots of data has been written in PubMed regarding the usefulness of mindfulness amongst healthcare professionals. The seminal article published in 2009 in JAMA by Mick Krasner and Ron Epstein, two of my teachers, showed that primary care physicians had decreased characteristics of burnout, and they had results that lasted well over a year, even after the intervention ended. Also, the study was pretty much replicated in other different cohorts of physicians, inclusive of family medicine physicians, as well as in critical care healthcare professionals. Amongst trainees, by and large, most of the data comes from the medical student population, but there have been promising results also shown in residents. So mindfulness, this word, sometimes conjures up images of people perhaps sitting in full lotus posture on a meditation cushion, or other such contrived images. But really, you can incorporate mindful moments that take no longer than a second, or that you can incorporate mindfulness into your day-to-day routines just by simply noticing. We also note that noticing something in nature, like being intentional about looking at the blue sky or trees, can help with wellness. When we are coming home from the clinical setting, you can bring an intentionality of focused attention to shed literally and figuratively your role, as well as the clothes from the clinical setting going into the home setting. And we wash our hands probably way more now than ever before. So you can bring a non-judgmental, simply noticing practice using the hand soap or using the alcohol gel that many of us apply as we're going to see a patient and then on the way out too. So you can enjoy mindfully the smells of the alcohol gel as it wafts up to your nose. And then with telemedicine being an integral part now of our clinical encounters, you can choose to intentionally make unique connections with our colleagues and patients. So during telemedicine visits, if something captures my attention, like a background or a pet, then I will ask the patient about it. So this type of connection is genuine in that I'm curious about that particular painting or that particular pet. Just yesterday, I had the opportunity to meet two goats that were part of the herd that my patient takes care of. So finding these unique opportunities for connections that otherwise might not have happened without telemedicine. So I wanted to break everyone up into groups of about 3 and to lead all of you in a mindful communication exercise. So how this is going to work is that there will be one person at a time that's the storyteller. And what you're going to tell your group about is a time, maybe recently, sometime during this pandemic, where you self-cared for yourself in a way that was kind of unusual or unique or new to you. Next slide, please. And for everyone else, as the storyteller is telling their story about self-care, the interviewers, so the other two people in the group, will remain silent for the duration of the storytelling. And at the end of the story, questions can be asked. However, the questions should only seek to clarify or draw out positive attributes. And so the interviewers do not judge, don't make interpretations, criticize, talk about themselves, give any advice. And so for each role, everyone is going to get a chance to be the storyteller. And I will give you about 4 minutes. And then I will also type out when it's about a minute before switching. So all 3 of you will get a chance to be storytellers. And if you have any questions at all, don't feel scared to pop in a question. And if you happen to be driving or anything like that, you can simply decline the invitation to be put into a breakout room, and Rosemary and I will do this activity together so that you don't miss out on this type of mindful communication. And so with that, I'm going to split everyone up into breakout groups. All right, let's see if this works. And I'm going to type the prompt again. Let's see here.
That looks great.
So, Rosemary, would you like to share a time when you took care of yourself in a way that was out of the ordinary?
Sure, I will. At some point into the COVID pandemic, one of my colleagues sent an email to the Pulm Crit Care group here, offering us gratitude journals. She said that she had been using this particular gratitude journal for some period of time, and when the COVID pandemic hit, she'd actually reached out to the publisher, to the company that makes the gratitude journal, and they had offered, I think, 100. They've sent her 100, donated 100 of these gratitude journals, and so she was reaching out to our group asking who would like one. And I thought this sounded very interesting. And so I have been using this journal, which was new for me. I have never journaled before, ever. Well, maybe when I was a kid for a very short period of time before some sibling of mine stole it or read it. And so I've been using this journal, and it not only asks for what are 3 amazing things that happened that day. At the end of the day, it has a section that you fill in at the beginning of the day, and then the section at the end of the day. And at the beginning of the day, one of the sections that I've been particularly enjoying is it asks you to list 3 things that, I'm trying to remember the prompt. The prompt is sort of like, what would make this day great? And I've been particularly enjoying that part of it because it's worked very nicely as a productivity mechanism, which gives me great joy. Yeah, I've been really enjoying this. I had previously been trying to have a gratitude practice as I commute home, sometimes on my bike, which I've not been doing at all recently, and sometimes by car, driving. And that had been variable. I think that this is more effective to actually get me to think. And there's also something, and I believe that there's evidence to back this up. There's something about physically writing that really helps things sink into one's brain.
Can I ask you more about that, Rosemary?
Yes, you may.
Was there anything in particular that in the recent past you wrote about that surprised you?
Ooh. Anything in particular in the recent past I wrote about that surprised me? I think I would have to spend quite a while thinking about that. I could even get out my journal when I get home and look through it to see if there is an answer to that question. Off the top of my head, I can't think of that, but thank you.
And how did you know that the gratitude journal was having a positive influence on you? Like, were there certain body sensations that you recognized or emotions that came up for you that showed you that?
Interesting. So I don't think I have any clear data to tell me that it's definitely making a difference for me, but I do enjoy it. I like your question, particularly because I find that I'm a relatively emotional person who will recognize the words will be out of my mouth before I've stopped to realize what's going on a lot of the time. And so you're sort of, making the point that there are clues that one can get from one's body to think about emotions, which is a very useful thing. So the thing that I've really noticed is that, some days you can feel like nothing good happened, but if you stop and you think about it, you will find that there were good things that happened. And they can be sort of seemingly small events, and yet they can actually be really worth reinforcing in one's brain that that was really nice. My son actually looked at me when he talked to me. It's a big deal.
Absolutely. Even you recounting the experience, you seem so joyful about something that had happened in the past. So even that reliving of the experience of gratitude, it seems to bring out so much joy in you.
Yeah, it's good. Are we at switch time?
Oh, I already texted them.
Would you like to tell a story, or do you think we should be preparing for people coming back?
I'll tell a quick story because I just told them to switch like a minute ago. But so last week, as mentioned in the introduction, I'm part of a dragon boat team, and we've been kayaking instead of being in a dragon boat because of physical distancing measures. So we're trying to abide by that. So kayaks, we can pretty much assume and regulate how much distance we have between each kayak. However, I'm also a paddleboarder, and I use paddling as a form of one of my go-to exercises. That, as the adage says, too much of everything or too much of something is not necessarily always good for you. And so after probably 3 different sessions of paddling between paddleboarding and kayaking, my hands started hurting a lot. And with being in the clinic setting, there's a lot of typing that's going on, and I decided, for the sake of self-care and resting my hands, I would opt out of practice last Tuesday. And usually I'm much more, I gotta show up for the team, I gotta push through this, my hands will be fine. But I recognized that in order for me to be pain-free at work, I would need to rest my hands from having to hold any sort of paddle. So thanks to COVID for making me realize that.
So do you feel that in addition to saving your hands, which is terribly important, do you feel there are other things about it that have been useful a useful experience?
Yes, because I think that my hand pain was also a surrogate marker for just total body fatigue. When you over-exercise, it's also not necessarily a good thing. So I took the opportunity to truly rest that day, give myself a rest day.
When you phrase it like that, it sounds like it might be a rare thing.
Yeah, so self-care, super important. Otherwise, I might not be able to type clinic notes or do procedures or listen to lung sounds without pain.
Mm-hmm.
So, good lesson for me.
Thank you.
Thanks, Rosemary. I think we're going to bring everyone back in about 30 seconds or so. And this was an experiment because we've never had a breakout part in these critical care training forums before. So now we know. All right, I'm gonna close out all the rooms. Oh, and then there's a timer that says the rooms will close out in 50 seconds. So Rosemary, about your gratitude journal, do you foresee yourself continuing that practice, like for the long term?
Yeah, I think so. I like it. I think it works for me, and it's cleverly designed. You know, it's described as the 5-minute gratitude journal, or maybe just the 5-minute journal, and that's like an amount of time that I feel I can devote to it.
All right, countdown, 5, 4, 3, 2, 1. Okay, well, welcome back, everyone. And I'm going to ask for you to share what you might have learned from your story of self-care or listening to your partner's story of self-care in this way. And feel free to put that in the chat box. Yeah, that we're all in this together, for sure. We might be from different countries, different states, different cities, but there is a certain common thread that runs through many of our experiences. Rosemary writes that you like talking to people. No one is safe until we're all safe. Hearing from others, so getting some different perspectives. Yeah, and that everyone has a different way of dealing with stress. And what their own story is and how they're dealing with it and what they're dealing with it. Yeah, and that these challenging times has allowed us all to experience new ways to better ourselves. Sleep has been a victim for all. And my follow-up question is, do we, or how is this type of communication different than the way that we usually communicate? This type of communication might be a little bit not familiar. Yeah, more listening, less talking. So we know that patient satisfaction scores actually go up when the practitioner does not talk as long as the patient during the clinic visit. So definitely more listening, less talking. Absolutely less judgmental, providing a safe space that is free of judgment for someone to share their story. Yeah, and it's hard sometimes because when we are in a more regular communication setting, there's a lot of back and forth, and that might actually impose upon the storytelling from coming to full fruition, or from a realization that the storyteller might make about themselves if you like interrupt with your own story, or a comparison or an affirmation. And absolutely, you can provide safe spaces and places to be vulnerable, and that being asked questions makes you feel special. Great. So how can people then take this type of communication out from this kind of lab setting, perhaps into your clinical encounters, or even with your family or your colleagues? Absolutely. So actually, the act of listening is a gift. Wonderful. Providing a space for someone else to tell their story, and really providing a space by not interrupting. Thinking about what are helpful comments. Yeah, there's data that shows during a clinic visit, a physician interrupts the patient during the HPI in like a few seconds, something ridiculously short. Yeah. So I encourage all of you to perhaps think about using this type of mindful communication in your clinical settings as well as your outside work settings, and see what happens. Be curious. Thank you for the opportunity to share one of my passions, and that's mindfulness. Back to you, Rosemary.
Thank you, Dr. Liang. Thank you so much for leading the session. So I lost a little time to my audio issues at the beginning, and I don't want us to run too long. So I might go a little fast through some of these slides, but they're really supposed to be sort of a wrap-up. And the idea with these summary slides here is that I'd love it if what happened after attending this session is that you're left with a little nugget of a thought of something that either reinforces something you're already doing, so that you're feeling like, actually, that thing I do, that's self-care. That's great. I'm doing self-care. Or that you think, hey, there's this thing that I'd really like to do. That would be great to do that. So I wanted to return to this notion that I'm not trying to push your self-care entirely on you. There are lots of other factors that contribute to this, but there's only so much we have in our control at any one time, and only so much that we can change. Changing organizational factors can take quite a bit more time. And so I'm a strong advocate for that and work hard on changing all sorts of things within my organizations, but it does take time. And I needed to be well myself before I could take that on. I like this model for thinking about the factors that affect healthcare provider wellness at work. It integrates parts from that NAM model, National Academy of Medicine, and parts of the refreshers. It puts in here the importance of social support and community at work. It puts in here meaning in work, that sense of purpose, how that's so important. And for healthcare providers, one of the things that can really lead to burnout is when we feel like we've lost our sense of purpose, that we're not getting to be the healthcare provider we wanted to be, that the work we're doing doesn't feel meaningful. That's really important for us. This paper from Shanafelt and Noseworthy actually gives a number of suggestions of action items that one could work on to improve wellness. There are all sorts of things one can do. As I said, some of those institutional items can take work groups and business models and presenting to leadership and can take some time. And then there are other things that can be, more easily implemented. It's all very personal. So for example, up in this work-life integration bucket, which it's their phrase, I like to think of it just as life integration because work is part of my life. It's not like work isn't my life. Actually, it's a big part of my life. It's really important to me. So as part of life integration, some people really like to limit their work email and really like to limit writing notes from home. For other people, that is just going to build up their stress levels, knowing that that email is just sitting there waiting for whenever you do get to it. So everybody's a little bit different. And I think what we choose to do, or what your colleagues or friends choose to do, it's important to accept non-judgmentally that everybody needs to work out for themselves what's the right thing for them. In terms of bigger picture, I think it is really important to think about, does what you're doing match your values? And is the role that you have the one that you want at the organization that you want? That's not something that you can change quickly, unlike the mindful moments or the gratitude practice, which are things one can do relatively easily. So just as a reminder, as I ask you to reflect and think, to take this moment to either congratulate yourself and reinforce some self-care you're doing, or to think about something new, this is the list of self-care that we've been talking about. So there's the refreshers and the positive emotions. And I actually spoke to the author of Refreshers, Polo Decano. He developed this for his PhD thesis. And a couple of things that he mentioned was that you can view the refreshers a bit like a menu to pick from of items that you can use, that you can also use it to look back and see, what have I been doing? And sometimes the things that we do that might feel a bit like wasting time might actually be self-care. So that sitting around having fun, that's self-care. If connecting on social media is one of the ways that you get your social connections, well, then that might be part of your self-care. There are a number of websites that you can look at. The top three I'm listing here are sort of large organizational change websites. And then the bottom one is the Mindful Healthcare Collective that was mentioned in Dr. Liang's bio. So this is a website that she's put together with some other healthcare providers who are also mindfulness teachers. And they offer a number of excellent resources to us on mindfulness. So here's my summary from the session, the take-home points. I hope to have convinced you, if you weren't already convinced, that self-care is not selfish. It's important for yourself. It's important for your patients. And that there are many systems issues that will affect our wellness, but we can help to combat that on a personal level and on an organizational level. And to remember that the keys to resiliency are healthy social connections, positive emotions, and a sense of purpose. And with that, I'd like to leave you with this poem, and I'll answer some questions and comments in a moment. I think this poem's really powerful. So, when this is over, may we never again take for granted a handshake with stranger, full shelves at the store, conversations with neighbors, a crowded theater, Friday night out, the taste of communion, a routine checkup, the school rush each morning, coffee with a friend, the stadium roaring, each deep breath, a boring Tuesday, life itself. When this ends, may we find that we have become more like the people we wanted to be, we were called to be, we hope to be, and may we stay that way, better for each other because of the worst. Excellent. So I'm wondering, Sushma, if there's any comments from the chat box that you'd like to bring back to us.
Yes, so thank you. First of all, thank you, Rosemary and Ni-Cheng. Your talks were amazing. It's so nice to hear from somebody that self-care is not selfish, despite no matter how many times we try to convince ourselves that that's the case. So I think the more and more people that say this, the more and more people that believe it, we will do us all a better service to ourselves and to our patients, to our families, to everybody around us. So thank you for this. We did have a couple of questions in the chat box. Looks like we have a couple of people on the webinar from Indonesia, and it seems like they're having some difficulty times there, just trying to manage the pandemic, spreading of false information. So I think the question is really about trying to manage some of that. And if you have any thoughts or recommendations on how to do that, or any ideas. I know that's a very difficult question, but perhaps some words of wisdom for everybody managing the COVID-19 pandemic now.
So difficult, isn't it? I mean, there's so many levels to there's so many levels to how to deal with people who are worried about misinformation. I mean, there's a lot of misinformation out there, and some of it's coming from what we would think of as being reputable sources. It's, you know, thinking about this on an individual patient level, I struggle a little bit. I'd be interested to hear other people's thoughts. You know, I certainly have plenty of patients who are extremely sensible and tell me about all of the proactive things they're doing to avoid exposure. And then I'll have a few patients who really seem to dismiss that COVID is a thing at all to be worried about, and maybe agree with some of the ideas that there's some kind of conspiracy theory going on. I don't really know how to deal with that. It's incredibly difficult. I'd be really interested if Dr. Liang, or indeed anybody on the webinar, has ideas about how best to have a conversation with a patient who seems to not believe that COVID-19 is a real health concern.
Dr. Liang, do you have any thoughts about this? You're on mute.
Okay, great.
Go ahead.
I think it's a really daunting task to try to change the opinions of the masses. I think that if we try to do that, we might actually end up burning ourselves out. And so for me, what I've been doing is doing my part, setting an example, and then using positive affirmations with my patients about doing their part. And that kind of spreads. When there's a patient encounter, for instance, the other day, a patient with asthma was not wearing a mask when this person was going out to public. And so from an individual perspective, like starting where the patient is, finding out the root cause of that thinking and of that, of like, why wouldn't you wear a mask while you're out in public if you have asthma? And kind of getting a sense of where they're coming from. So I think being willing to listen to the opinions, however potentially not data-driven they are, I think opens up the ability to have a compassionate discussion, and realizing that we can really, truly never change the actions or the thoughts of other human beings. We can seek to influence, but we can't ever truly control the actions or thoughts of another human, which doesn't mean that we shouldn't try, but I think trying and meeting where they are, yes, bringing up data, and yes, setting a role model. So starting where you're at, I think, is basically the short answer to a very long and difficult situation.
Yes, I think I hear you. You didn't use these precise words, but I think I heard you sort of paraphrase, assume positive intent. So, you know, we all have our reasons for why we do things, and a lot of them are good. And so taking the approach of, well, I'd like to understand why you think that. What made you feel that way, or what made you think that way? It seems like a really great idea. Yeah.
Yeah, thank you both for that. We do have some medical students who are on the webinar, and we had a question from one of our medical students about words of wisdom in dealing with stress of studying during the pandemic, and how to kind of manage potentially not being able to be a part of your rotation, or not being able to take part in these patients. And I think there are a lot of struggles that our students are dealing with in so many ways. So any words of wisdom for our medical students and other students that are on the webinar?
I will start. Well, first of all, congratulations for being in medical school. I mean, like, that in and of itself is an amazing accomplishment, and welcome to this forum and to all the different professional societies in the world of all of the different subspecialties. Like, you are truly part of our team. And it's unfortunate that this pandemic is perhaps restricting the access that you might otherwise have to in-person patient encounters like the rotations, but know that the knowledge that you've been studying for is going to help another human being. And so I think that with the stress of studying during coronavirus, I would just recommend that you do the best that you can and trust in the educational system that your deans of your medical school are going to do the best that they can to ensure that you come out of medical school prepared and a competent and compassionate clinician or researcher or whatever role you end up with after you graduate from medical school.
Yes, absolutely. I agree with that.
Maybe I can comment on that as well. So I think we've been facing the same questions from our medical students here at Maryland. And the reality is that I think everything that Dr. Liang said is absolutely 100% accurate. And what we're trying to do is make sure we mitigate risk with also providing you with the foundation that that you need to go out and really be a part of the team that's helping to take care of all of these patients. This is not something that's going to basically go away overnight, unfortunately. And we, for our pre-clerkship students, we say study as hard as you can because we need you to solve the problems that we can't solve today. And so study as hard as you can, learn as much as you can, build that foundation, and then build upon it further. The other thing that we've done is tried to create situations where medical students can participate in some aspect of our response to this pandemic without compromising themselves. And so that might be calling patients on via Zoom to just talk to them and check in with them because they haven't been getting visitors. Or it might be working with our clinical informatics team to basically deliver these iPads that we're doing for Zoom to all the different units where they don't need to use PPE and stuff like that to go into the actual biocontainment unit. So there are different ways that people can get involved and just support each other. I think that the wellness talk that we just heard today applies to every single level. And to be there for each other in whatever way. And so I'll tell you that some days where when I was in the ICU, some of my hardest days, if I got an email from a student that was like, "Hey, Dr. Shah, just checking in, wanted to tell you that we're right here behind you as you were in the ICU," that made my entire day worth it, even though there were so many difficult aspects of each part of that day. So no act is small, I would say. That all of them have long-ranging impacts. So anything that you do, I think, is meaningful in this time.
Absolutely. Thanks, Nirav. Well, I don't see any more questions in the chat, and we're at 9:12. So I just want to thank our speakers again. Thank you for this. Such an important talk, and this poem at the end is just amazing, Rosemary. So thank you for that. We'll definitely need to grab that slide of yours and post it on our website so everyone can refer back to it. So thank you again. Thank you all for joining, and be well. Bye, everybody.
Take care. Bye.